warahmatullahi wabarakatuh. Thank you for that introduction, Ashraf. I'm going to be speaking on modern health benefits and insights of fasting from Islamic practices. So let's just get started. I think in terms of what I'm going to cover today, first of all is the relevance of fasting, types of fasting, modern health benefits of fasting, and then insights from Islamic practices as well. And I think yesterday we had a full session on very prominent speakers on obesity. We had about, I think, five very prominent speakers, speaking about obesity. And so I'm not going to go much into that today. Types of fasting. There's different, as Professor Rasa said, there's different types of fasting. And I'm just going to go a bit into more detail about that. I'm also going to speak about some of the modern health benefits of fasting. And then lastly, I'm going to tie that in with insights from Islamic practices. And for me, that is the miracle of the Sunnah and the Quran, when you connect all of these things together. And I think perhaps my whole talk can actually just be summarized by the Qira'ah that Sheikh recited in his opening address. And that also just really summarizes my talk. But let's continue. So of course people asked, you're a psychiatrist, why are you talking about fasting? And of course the reason for that is that of course spirituality is one of my interests, and of course Islamic spirituality and mental health as well. And that's how I came onto fasting, and I made these connections. But you can just look here that this is an American study that shows what are the top health concerns amongst Americans. Okay, and of course, number one, 53% is mental health. And what's number two? Obesity. Okay, and of course, there might be a connection between the two, and I think that's an important question. So maybe it's not a coincidence that I'm speaking about fasting today, but you can make up your own mind about that. So I'm not going to go into overnutrition. I mean, the speakers went into lots of detail with regards to that yesterday, except to say that I think when we speak about overnutrition, we refer to both being overweight and being obese. But basically, overnutrition, we know we have over 1 billion people who are obese worldwide. Okay, so it's a worldwide problem. And basically, the illnesses associated with this contribute to huge social, medical, and economic burdens on countries. And as we said yesterday, obesity is a chronic and it's a multi-systemic disease. The effects are not based on one particular system. Okay, but we do know about cardiovascular disease. We spoke yesterday about metabolic diseases. One of the speakers also mentioned yesterday, is Alzheimer's type 3 diabetes. Okay. 5-10 years ago already, there was a lot of papers on that. And I will touch upon that as well. And then, of course, obesity and being overweight increases the risk of a number, I think up to 13 cancers are associated with obesity. So I think it's important to remember this. And as I said, we can see that it's a chronic, multi-systemic illness. Okay, and I think that's highlights the importance and the efforts that we need to find more effective and economical strategies for weight loss in individuals with overnutrition. Okay, so just about types of fasting. Basically, there's two big groups. So there's, on the one side is caloric restriction, and that just refers to limiting your total caloric intake. There's lots of different regimens, anything between 10 to 50, 60%. What are the RDA requirements? This is how you need to eat. And some people are very strict on this, to the effect of having apps, and you need to put how many grams of what food you ate and how many calories it is. Very complicated, but it is there. And then fasting refers to the alteration of meal frequency by controlling the timing of feeding and prolonging the fasting time between day, hours and even days. And then there's also different types of fasting. And again, I'm not going to go into detail. This is a big topic, but just to summarize the different types of fasting. So there's basically, Ramadan would fall under the time-restricted fasting. Okay, we have a fasting window, and you only eat during a certain number of hours per day. Okay, intermittent fasting, as Professor Rasha says, you alternate between eating and not eating, but of course the difference is there that you can consume fluids. And because this is so difficult, they've tried to make it easier. So the literature talks about 5-2 intermittent fasting. So what that means is you only fast 2 days of the week, because it's so difficult to fast every day. The 5-2 fasting makes it a bit easier, that you fast 2 days per week and the other 5 days you eat as normal. And then there's also the alternate day fasting, if you feel you can do a bit more than that. And then if that's still too difficult, we get the fasting mimicking diet, where instead of restricting calories every day, you restrict calories for about 5 days per month. Okay, so that just summarizes the different types of fasting here. So there's time-restricted fasting, intermittent fasting, fasting mimicking diet, and then of course the different varieties there. So what is it about fasting that causes its health benefits? And the literature speaks about this metabolic switching, and that seems to be the key in all types of fasting. Okay, and again, some physiology here, but just basic physiology is that in the fed state, glucose levels are high, and glucose is used for energy, and fat is stored in adipose tissue as triglycerides. In the fasting state, which usually happens after anything between 8 to 10 hours, the opposite happens. So basically there's no more glucose. The body's glucose supply from the liver muscle in terms of gluconeogenesis is depleted, and triglycerides are then broken down to fatty acids and glycerol, and the liver also converts fatty acids to ketone bodies, and ketone bodies, we know, then becomes a major source of energy for most tissues, and especially in the brain. Okay, so I always tell people that the brain makes up 1% of our body weight, but consumes 25% of our total energy requirements. Okay, so ketones become very important in fuel supply to the brain when fasting induces this metabolic switching, okay, from glucose to ketones. Okay, and what's important with overnutrition is that the traditional dietary recommendations encourage us to have 3 main meals a day with 2 to 3 snacks in between. Okay, so the body is constantly in a fed state. Okay, and this happens from school. You know, you have your breakfast in the morning, you have 2 breaks at school, first break, second break, you eat in those 2 breaks, you get home, you eat at home, and then you eat in the evening, and before you go to bed you have another snack. So this is something that starts in childhood already. And that's why South African adolescent obesity rates are currently over 20%. Okay, because previous or traditional dietary recommendations keeps the body constantly in a fed state. So this switching never happens, or rarely happens, and the 8 to 12 hours, the 8 hours of sleep that we get is not enough to induce the switching. Okay, and very importantly, the same switching happens when we exercise. So the same process, when you exercise after a certain period, when your glucose levels get depleted, the same switching happens. And unfortunately, there are no talks about exercise, but that's another talk on its own, the benefits of exercise. But again, it's the same mechanism. Glucose is depleted, there's a switching over, and that's where the beneficial actions happen. So as I said before, there's pervasive benefits of fasting in different systems and organs. It's a multi-systemic disease. This just shows some of the benefits. It's really a very big topic. You can take that down if you want to go read up on it. But multi-systemic effects and benefits of fasting, from the immune system, endocrine system, and very importantly, we'll see here decreased glucose tolerance, but increased beta cell survival. Okay, the same in the nervous system, increased memory, but hippocampal neurogenesis. Okay, circulatory system, decreased inflammation, immune system rejuvenation, and we can see the details that happens in the different organs, from muscle to gut. We spoke yesterday about gut microbiota. In the pancreas, there's decreased beta cell apoptosis, and we know that that's beta cell apoptosis is associated with overnutrition. Why? Because the body's in a constant fed state. So we deplete all our insulin by the time that we're 20, 30. Okay. Lots of effects of the brain. Yesterday we spoke about the effects on the heart. And then of course in the liver as well. Okay. So as we said, switching also induces an adaptive biological stress response that activates multiple biological mechanisms in multiple organs that I've alluded to. And what's interesting is that this was only recently discovered. So less than 10 years ago. 10 years ago, we didn't know about this. Okay, and the Japanese gentleman Osumi, he won the 2016 Nobel Prize in Physiology and Medicine in discovering mechanisms of autophagy. And we know that fasting, not only in humans, his work was done in yeast cells, monocellular organisms. Okay, so fasting induces autophagy, and that's a process by which cells break down and they destroy old, damaged, abnormal proteins. It's basically The cells know, hey, there's no more glucose. We can't be wasting energy here. Let's see what we can save. Let's recycle. Instead of throwing everything out, let's see what we can keep and what can we recycle. Okay? And this encourages cell renewal, as I said, the recycling, but it goes deeper than that. It goes down to protein control, DNA repair, mitochondrial biogenesis, and it's also, as Tasneem mentions, also affects cancer cells as well. And very importantly, fasting delays aging. Okay, so this whole process of autophagy also delays aging, and again, chronobiology is a topic on its own. It's a paper on its own. Chronobiology. So if anyone has exercised, or you do a run, or you go on to Garmin, or you do, for those of from South Africa, you do your Discovery annual assessment. It will give you your chronological age, which is the day you were born. So if you're born 40 years ago, you're 40 years old. But then it also gives you, based on your exercise, your biological age. Okay, so you can be 40 years old, but you can actually be as fit as a 35-year-old. And you can be 40 years old, and you can actually be as unfit as a 50-year-old. Okay? And this is where fasting plays a big role in chronobiology. And again, this is just one slide which shows how fasting delays aging. So over years, all the stuff that happens with aging, telomere attrition, lots of proteases, cells die, nutrient missensing, epigenetic alterations, stem cell exhaustion, mitochondrial dysfunction, genetic instability, and you can see a lot of these are also linked to cancer. Okay, and that's why intermittent fasting might play a role with that. And this is where I come to the clinical implications or the clinical benefits, is that most studies show a 3 to 8% loss from baseline, weight loss over 8 to 12 week period. And interestingly, the majority of weight loss is through loss of subcutaneous fat mass. Okay, and it's important to tell patients this, because if you look at a kilo of fat and a kilo of muscle, okay, it's not going to show the effects on the scale, but it might show the effects in terms of visceral fat, abdominal circumference, and for example, visceral fat mass. I mean, there's good evidence for fasting in non-alcoholic fatty liver disease. Okay, so we said, and even in healthy people, and I think this is what's important, is that we can't wait. As Tasneem has shown, when you become insulin dependent, when you have renal disease, it's too late, you've missed the boat. Fasting is actually bad for you. So we want to prevent those chronic diseases before they get to those stages. Okay, and this is again some of the clinical implications of fasting. I think Tasneem alluded to this. I'm not going to go into much detail. We also spoke about cardiovascular benefits of fasting yesterday, improvement in mood, which happens from day 2 of fasting, improvement in mood, alertness, and a sense of tranquility. And that's why people, during Ramadan, people become excited about Ramadan. And people who don't fast, they can't understand this. What? You came without food for a month, and yet you're excited and you're talking about it 2 weeks before the time. Why is that? Because of the mood elevating Okay. Taslim spoke about the cancer. And then again, neurodegenerative diseases. Two most common neurodegenerative diseases, Alzheimer's, Parkinson's. And we both know that these are associated with age. And again, as I said, we can't wait until these diseases start. Because when we look at the benefits of fasting, fasting in the hippocampus promotes hippocampal neurogenesis. So, just as we said in aging, not only does it prevent aging, but it promotes hippocampal neurogenesis. Alzheimer's disease is associated with the hippocampus is atrophied. We can't remember because we can't make new memories. Okay. I'm going to end off just about another 10 minutes. So basically coming to the insights from the Islamic practices, people might say, wow, what's this got to do with Islam? Anyone can fast. That's true. And the history shows us that as early as the 5th century BC, Hippocrates said fast for acute and chronic illnesses. And when he saw that our appetite goes away when we have a fever, when we are ill, he saw that as due to the immune modulating effects of fasting. So we stopped eating to prime our immune system to fight the infection, rather than we not eating because we're feeling ill. Okay, and we know most of the other major religious traditions include fasting, so it's not only an Islamic practice. I don't need to, this was our opening qira. So we can see Almighty tells us that fasting has been prescribed for you as it was before. Don't think you're special. It was done before you already. Okay, in order that we may develop God consciousness. Okay, and 5 more minutes, just challenges related to the weight loss regimens. I'm going to bring this in here for the simple reason that we all speak to our patients. As Taslim had said, even with Ramadan fasting and whatever intervention you take, apart maybe from the permanent surgical interventions, drug inventions, whatever it is, you stop the intervention 3 to 6 months down the line, you're back to the previous baseline. And this is a problem, okay? Even with other interventions, not only related to fasting, there's problems with cost, availability of medication, access to weight loss regimens, consistency. Patients find it really, really hard to continue, okay? And they say, it's really hard, doctor. And for me, this is where our religion comes in. This is just a hadith that was quoted in Muslim. So because for time constraints, the Prophet was asked about fasting. One of the companions found it really hard to fast, and this is not Ramadan fasting, these are the extra fasting. And the Prophet said, who has strength to fast for 2 days and then break for 1 day? He was asked about fasting for a day and breaking for 2 days, whereupon he said, may Allah bestow upon us strength to do it. And then he was asked about fasting for a day and breaking on the other, and he said, this is the fasting of my brother David. Okay, so again, and just read one of the hadith chapters on fasting. Okay, these are just some of the benefits of fasting, and this doesn't only, we know Ramadan fasting is compulsory, these are the extra fasts. Okay, basically Hajj time, Muharram time, Shawwal, we know whoever fasts during the month of Ramadan, you follow for 6 days afterwards. Look how Almighty is priming us. What's the problem? You stop the intervention 6 months later, you're back to baseline. What does the Quran and what does the Sunnah say? What motivations do we have here to continue fasting afterwards? Okay, more motivations, hadith. That if you fast for the 6 days of Shawwal, it's as if you fast for the entire year. Okay? So lots of motivations from the Quran, from the Sunnah. Okay, and then just to end off, I got 2 more slides. We know that fasting is one of the 5 pillars, and look at the other 3 pillars. Look at Salah, Zakah, and Hajj. Okay, do we only do in these? Do we only do what is compulsory, or do we do the Sunnah and the compulsory? Okay, do we do the optional when you make wudu? The compulsory part of the ablution is only 4 things. 4. Most of us, we do over 20. We don't do the minimum. The same with Salah. We have 5 daily prayers with 17 raka'ats. The optional prayers for the day is much more than what the compulsory is. Zakah, 2.5% once a year. This sadaqah lillah. The Prophet ﷺ used to give sadaqah every single day. Okay, so we always do more. Hajj as well. Hajj is Arafah. We say as long as you're on Arafah, you've completed the Hajj. But we do much more than just go to Arafah. Okay, and the same should apply for fasting. Okay, and I'm just bringing you back to the different types of fasting, and again reminding you about the Sunnah types of fasting. Just one more slide. So it's Ramadan fasting, Sunnah fasting, the white days. And remember I spoke about exercise. What does the Almighty tell us? What's the Sunnah? You fast for 14, 12, 14, 16 hours. You break your fast for Maghrib. 1 hour, 10 minutes later, Almighty tells you, go make Tarawih. Okay? And then it's your 8, 12 or your 20 raka'ats. Okay, if you overeat, as Taslim said, Ramadan fasting, some of the studies shows increased caloric intake, not decreased. Okay, and if you do your Sunnah fast, you're not going to go through all the efforts you go in Ramadan to prepare all your special meals. Whatever's on the table, you're going to have to eat. Okay. So this is just my last few slides, and this brings us back to half what this conference is about: healthy families, healthy communities. Remember that again, fasting is not only about nutrition. Okay, psychiatrists see eating disorders because we know eating is associated with emotions. Okay, and we can see this in our religion. It's not just about what you eat. If you're swearing and fasting, what does the Sunnah say? You might as well go eat. Okay, and these are the factors that are associated: psychological well-being, resilience. Okay, and as we said in the first slide, what are the main problems that the world is facing? Number one is mental health problems. Okay, so in conclusion, although fasting has been around for centuries, only recently has modern science started to elucidate the multiple potential scientific mechanisms and benefits associated with fasting, and the various types of fasting practices in the Islamic tradition is similar to current modern fasting regimens, especially the Sunnah fast. And as Taslim said, there is no data. There is no data on long-term effects, on long-term fasting outside of Ramadan. But again, for those of you who listen to Sheikh Zaid's Qira, okay, and go read, I think it's chapter 2, verse 183 to 186. Okay, go read that. Those of you who don't understand Arabic, read the English. And Almighty says, you know, be grateful because I've told you what to do. Okay? And this is especially important with increasing secularization. Okay? Where people say, why do I have to do Ramadan fasting? I can just do intermittent fasting. Okay? There's another benefit that, you know, around Ramadan, 1 billion people fast at the same time. How's that for motivation? If you speak to one of your non-Muslim colleagues and ask them to fast for a day, you know, it's difficult for them, but we get our children 5, 6 years old to start fasting half day. Okay, the socialization aspect of fasting is also very, very important, and that also assists with motivation. Okay, shukran.